33 weeks pregnant with a baby girl.
We haven't been able to start the treatment right away because Mindy is pregnant, and that's probably the biggest burden because you want to attack it as quickly as you can.
I am just taking everything day by day, hanging in there, and just counting down the weeks and days till we can be finished with it. Watching my dad die from cancer and knowing the pain and hurt and watching the family get their rawest emotions out was hard for me because I wondered if I was putting my family through the same thing.
Hello! I made it! This book, I wrote down some medical history. When you hear the word cancer, it seems like that's so final. You're so frightened, all these things go through your mind.
We got Chet Jr. and Jan here, colon cancer for Dad.
This is what our family has. We do cancer. That's the card we're dealt.
His mom had breast cancer and his dad had prostate. And then over on your side, we've got prostate and cervical.
It's very hard to go through this as a parent. When they're little, you can pretty much keep them from harm. But when they get older and on their own, it's very hard to realize that you can't help them.
That's not pretty.
You don't think of it as when you put it down and you have the whole picture, it's scary.
Now I'm gonna be a little bit paranoid with all this in the family.
Linda?
Yes.
Hi guys.
Hello.
Hello.
How you doing?
Fine, how are you?
Living the dream. The cancer itself does not necessarily increase the risk to the baby. The biggest issue in this particular situation is going to be prematurity, depending on how far out we can take the pregnancy. One of the things is the issue of a fetal lung maturity or not.
Yeah.
With advances in perinatal and neonatal medicine, it's certainly lowered the gestational age where the babies can survive, but certainly that risk of survival decreases as you get earlier, as well as the risk of problems increase. We'd probably be comfortable with looking at finding a time, do an amnio, see if lungs have matured.
Rather her not have to go to
the NICU.
Yeah.
And that's kind
I
of
think it was at 36 weeks. It's a 50-50 chance that she might end up in the NICU. So that's why they want to do an amnio and just be sure. When I found out that we had to wait 2 more weeks, I thought I would be just absolutely devastated. But being pregnant actually turned that around for me and made it a fight, because I'm not just fighting for myself now. I've got a little one to think about. This has gone on long enough. I'm starting to get that worried feeling back. I got on the internet and I started looking at what happens when cervical cancer spreads. My doctors told me not to get on the internet and look around, But I was craving knowledge.
This story that I found on the website is where this gal had cervical cancer, and I read her story because I was optimistic, and at the end I found out that she had terminated her pregnancy. So that wasn't something that I wanted to see, but that was hard to watch. That was hard to read.
We picked today, which is she's 38 weeks today, and did not repeat the amniome because we felt at that point the likelihood of baby's lungs being mature was most likely the case.
It's bittersweet. I'm ready and ready to go. Get taken care of.
It really takes two surgical teams. Dr. Bonebrake and his team will do the cesarean section and deliver the baby. And really, once they've completed that, myself and my partner, Dr. Krotzer, will take over and proceed with the radical hysterectomy.
Well. Mandy meeting you here.
Come on.
It's just scary, like I pictured it would be, and a lot of stuff going on, and I just wanted to get it done. But 2 miracles about to happen, I guess. I was about as happy as I could be under the circumstances.
There she goes.
Got a lot to start there, Mom.
Okay, there you go.
Let's move some chairs.
She's beautiful.
There you go, Dad.
That's just chair, Betty.
There you go.
Here we go. Greta. Now this medicine's going to make you feel sleepy, relaxed, right?
And she'll go under general anesthesia now for the remainder of the radical hysterectomy.
A little longer to get the baby just because the incision we're going to make, so than typical.
We're really hoping that this surgical procedure is the curative procedure for Mindy. But I don't know that for sure until I have all the final tissue analysis or pathology analysis, and that'll take a few days.
Looking good.
Today was a very difficult, emotional day. I would feel like laughing one minute and kind of crying the next, so it's just, yeah, tumultuous would be the word for it.
I guess I equate it to someone who just maybe got done running a sprint or something like that, just breathing twice as hard.
When they wheeled me into the NICU and I saw her under this big glass dome, I just thought, this is just one more thing.
They told us there's always that chance because she was still being delivered early that could happen. So it wasn't that it was totally out of the blue it was going to happen, but you know, the word NICU and hearing a baby, you know, kind of renders some tough thoughts.
Wanted a normal end to the pregnancy, but this is quite different and not what I ever pictured, so I'm praying that it's just that everybody comes out healthy. So. Sammy stayed in the NICU and just worked on her breathing. It feels great to finally have her home.
Some of the darkest thoughts that come to your mind are, you know, what would happen if something does happen to Mindy after the pregnancy.